So my name is Rachel Kay. For this video, we're going to be doing venipuncture of a vacuum tube system. So first thing I want to do is introduce myself to the patient. So I'm Rachel. I'm going to be your medical assistant today. Can you please identify yourself by name and date of birth? Okay. So what we're going to do today is we're going to do two different lab draws today that your doctor has ordered. So the first thing I want to do now is apply the tourniquet, palpating for the venipuncture site. So we're going to go ahead and apply your tourniquet first. Okay. Once you've done that, you're going to palpate for the vein here. Okay, I found the one that I want to use right here. We're going to remove the tourniquet immediately. Okay, then we are going to wash our hands and then we're going to apply our gloves. Okay, once we have done that, we are going to reapply our tourniquet here. We're going to take our alcohol prep pad here, cleanse the site. I am going to ask the patient at this time to go ahead and make a fist without pumping their fist, just so that way we can get better blood flow. Maybe if this alcohol wipe would come out. So you want to do inside going outwards. Okay. You want to allow that to dry. Once you've allowed that to dry, next thing you're going to do is draw a skin taut here. We are going to assemble our equipment before I do that. So I'm going to go ahead and apply our needle in here. I'm going to take it out of the tube. Go ahead and put that bad boy together. And then I'm going to go ahead and draw the skin taut, making sure the bevels face up to me. Then we're going to find that spot there. Okay. Once we get that bad boy in there, the same one that put the tube in there is going to be the one that holds it. We're going to get our tube here. We're going to apply it. Okay. You want to put the needle in about 1/4 of the way. You don't want it to go in too much further. Okay. We're going to let go of the skin, grasp the flange of the tube. Once we fill it up, we want to turn it to allow the mixture, the coagulant, to mix with the blood. We're going to repeat that with our second tube here. We're going to immediately mix that one again. Once the blood has ceased to flow into the tube, we can go ahead and remove it and immediately start turning it just like this to allow the blood flow to mix, or excuse me, allow the blood to mix with the anticoagulant. We are then going to take our cotton ball here. We're going to place it on the draw site here. Gently remove our needle. We're going to apply the safety device, which I don't have right now, but we're going to just dispose of it in our sharps container or our biohazard container. You want to hold it for about 2 to 3 minutes to make sure the bleeding has stopped. What you can also do is you can take an adhesive wrap here. You want to dispose the contaminated piece of gauze first. Let's see. Okay. And then you want to get your other piece of gauze off to the side here. You want to tear your little piece off that I already have done. We're going to apply that right there. Put on some self-adhering bandage wrap here. After the needle comes out, you want to remove your tourniquet. Now what you can do is go ahead and wrap it with that self-adhering bandage. Jesus. Once you've got that, you can go ahead and tear it. Okay. And then I'm going to go ahead and check the patient for signs of stress, such as dizziness, headache, lightheadedness, anything that would trigger any kind of sign of stress in the patient after giving blood. And if the bleeding has stopped, you want to go ahead and remove your gloves properly with the right technique. Then you want to dispose of them in your biohazard container, which for me is off to the side here. And you want to wash your hands, and then you want to document the patient's chart and the lab requisition for the blood work you just did.